this patient came to see me regarding tooth number 3. According to the patient, the crown is only 2 years old, and patient says ever since the crown, the tooth has been bothering him. The tooth has never felt the same. Tooth hurts to heat, cold, and sometimes chewing and biting on the tooth. And patient also complained of food pocket between number 2 and 3, and said that he even developed a gum abscess, and he cleaned out the food that was stuck between 2 and 3, and once he cleaned that area out really well, the gum abscess went away. But he was mainly, of course, here to see me for tooth number 3. As I said, crown 2 years old, pain to chewing, biting on the tooth sometimes, and also pain to hot and cold. So I examined the tooth, and it was tender to percussion and biting. Probings were 2 to 3 millimeters here around the tooth, and in the distal they were around 4 to 5 millimeters with bleeding. Looking at the radiograph, you can tell that this is a special tooth. Look how deep that pulp chamber extends, and you can see that there is calcification, looks like, of the canals. You can't even see the canals there. So tooth number 2 was within normal limit, responded within normal limits to percussion, palpation, and biting on the tooth. But as you can see, root canal, according to the patient, was done 15 years ago, but looks like a periapical relucency happening there. All right, so I went over options with the patient regarding tooth number 3, and patient decided that at the time he could live with tooth number 3. He wanted to postpone endodontic treatment, and of course we respected that. Yesterday, a patient called and said, I can't do it anymore. This tooth now hurts. It kind of even wakes me up in the middle of the night, and I want to get the root canal done. I said, fine. In the meanwhile, we tried to get x-rays of tooth number 2 just to see what's going on in that periapical area there. It looks like periapical relucency, and I honestly think that there's a missed canal there, missed root. Right there, I can kind of see it. Yeah, very rarely the upper second molars have 2 canals. I mean, I've had cases where they in fact did have 2 canals, or maybe I've had cases where they had 1 canal. But in this case, I really believe that whoever did this root canal 15 years ago missed the mesiobuccal root. All right, so patient came in today, so we can work on tooth number 3 today. All right, so okay, so let's take a look here. You can see what I'm talking about regarding tooth number 2. Definitely there's a missed root there, and there's a periapical relucency right there. Definitely there's a missed root. MB root was missed. All right, so we also got some x-rays from the patient's general dentist. Again, every general dentist we called, they only had bite wings. The first one, this one was from 2019, bite wing. This is from 2020, bite wing. This is from 2021. This dentist had 1 PA, and you can again see the periapical relucency here, and some apical root resorption too, by the way. So this is from 2021, so from 3 years ago. This one is from 2023, not a very good diagnostic, but again, you can see looks like a missed mesiobuccal root and periapical relucency there. And this was from 2 months ago, and again, you can see a periapical relucency and very likely missed mesiobuccal root there. So I let the patient know it's very likely we will have to redo this root canal in tooth number 2, and patient agreed. But for today, Patient came in so we can work on this tooth number 3 and take a look. And here's the post-op. As you can see, everything went beautifully. MB, there was no MB2, and this is the MB1. No MB2, I trough for it, not there. That's the distal buccal canal, and this is the palatal canal, right there. Very interesting anatomy, this tooth number 3. So I actually first found the distal buccal and palatal, and honestly, I'm like, is this tooth number 3? Is it the same as tooth number 2? Maybe 2 canals? Then I started troughing mesially, and I hit the mesiobuccal root. I hit the mesiobuccal canal, and you can see it right there. So again, you can see. So that's the distal buccal, that's the mesiobuccal, and that's the palatal. Okay, so I wholeheartedly believe that there is a missed mesiobuccal canal right there, that the dentist who did the root canal missed. Anyways, tooth number 3, root canal, as you can see, went beautifully. We temporized the tooth and referred the patient back to his dentist for the permanent restoration.